2015 marks the 50th anniversary of Medicare, Medicaid, and the Older Americans Act, as well as the 80th anniversary of Social Security. As Florida's population of 65 and over grows and is anticipated to nearly double in 25 years, many are asking for improvements to these programs to prepare and ensure proper long-term care for the aging. In July, the White House held their conference on aging, where it addressed many of these issues, including how technology, for instance, can help make Medicare solvent. Our first guest says tax deductions and other support systems are also necessary to assist South Florida's growing elderly population. Joining me to discuss this and more, we welcome former State Representative Elaine Bloom. Ms. Bloom was Speaker pro tempore from 1992 to 1994 and is currently President and CEO of Plaza Health Network. Thank you so much for being here. As I said in the opening comments, Medicare is sort of perhaps perceived by some at a crisis state. There is a lot of concern over the extent to which Medicare itself may be insolvent in 15 years, facing, quote, an unfunded liability of nearly $30 trillion. So what are the long-term issues for us, especially here in Florida? And I guess nationally, too. Well,
we obviously want to make sure that Medicare continues as it is. I can tell you as a Medicare recipient, as a Social Security recipient, it's great. And I think that's why you find people at all points on the political spectrum always saying, don't touch my Medicare. Unfortunately, a lot of candidates still want to touch Medicare. But the report that came out last year from the Medicare trustees found that the life of the Medicare Trust Fund had actually been extended to the year 2030. So over the 7 years of the Obama administration, we've been able to make the Medicare Trust Fund extend out longer. So whatever is needed will go past that point.
How did we extend that? I think it's just through debt and deficits, though.
No? The fact is that the money is there. We are paying into it. Everybody pays into it, and the question is whether the money's been borrowed by the Congress for use in other areas, in which case they have an IOU that's there.
Right. It's just hard to sort of wrap one's head around. I mean, this issue is so complicated, and I know, for instance, for every $100,000 a person spends into the system over the course of their lifetime, they receive approximately $300,000 back. And if the ratio of retirees to workers is lessened. For instance, back in the 1940s and 50s, we had 50 workers per every one retiree. Now we have 3 workers per every one retiree. How is this solvent after 2030, though, still?
They're managing it. So I'm not going to go into the details because I'm really not cognizant of them. But I can tell you that Medicare has been able to hold the line in a lot of areas. That's why you see a lot of hospitals complaining, you see doctors complaining,
right,
because to a great extent it has to do with the reimbursement rates. I can tell you that between Medicare and Medicaid, we are caring for many more people than we did in the past, but with very stringent guidelines. And that's good, because it's the public's money, but it's also the individual's money. All the money that was paid into Medicare and Social Security came from the individual's hard work.
Right.
And right now, as you know, it's a combination of the employer and the employee that adds up to 15% of the average person's salary. So that's a little over 15%, so that's all to the good. What we don't want to see is a reduction in the quality of the services. Fortunately, there have been ways to hold the line. But one of the most serious issues is the fact that when Medicare Part D was established by the Congress under President Bush, the requirement by the Republicans was that the pharmaceutical industry not be forced to make bargains with the Medicare program. So Medicaid and the Veterans Administration can negotiate prices on medications. Medicare cannot. That is a killer. That is a huge amount.
So that's one of the things you would like to see restored, is the negotiation of prices.
Absolutely.
Over prescription
I think
medicine.
that is essential.
Yeah. What other things do you hope for? I mean, you have a stellar reputation in the House of Representatives and a champion sort of these issues. And you recently wrote an op-ed in the Miami Herald on July 12th talking about this, which is a phenomenal piece. Can you speak to a little bit more about what you would like to see happen?
Well, there are lots of possibilities. The fact is that most of the people who are going to need services will not be served in facilities such as my excellent facilities. They will be served at home. And a lot of them will be served by family caregivers. So we really need to give a great deal of thought to how we accommodate the needs of family caregivers, what we do to make their lives easier to keep doing this, and also the fact that they should be able to have some tax deduction for something that's verifiable in terms of their spending their time and effort taking care of an elderly.
I think that's a phenomenal point. Consider tax deduction for family members or other unpaid caregivers who have responsibility for care of these elderly.
But it would have to be verifiable. That's the problem.
True.
You can't just be my word and I write a little note. They have to be able to have some system that will be put in place. But there are so many other things. For example, senior citizens on Medicare tend to have a lot of doctor visits, those who use the system. And the reason I say that is because, fortunately, there are some people who remain healthy throughout, and there are some people who've had a long history of being ill and needing a lot of doctors, and some people who, because of the natural process of aging, need them. And it's a very time-consuming thing to get people to and from doctor visits and to wait in doctor's offices. So we might need to create a new category of people who, in effect, become a patient assistant, picking up the individual, taking them to the doctor, staying with them, and then bringing them home again.
Yeah.
At a lower cost person than perhaps the individual who has to take time off from work and can't.
You also alluded to, and at the outset of our opening here too, the use of technology, specifically also now Uber and transportation, announcing pilot programs in Florida that will partner with senior community centers and other advocate centers to provide technology tutorials and free discounted rides to and from their places of care.
Well, and we do have a whole system in place for transportation for the elderly, which I was one of the people who helped put that into the system many years ago. I welcome everybody's assistance and everybody's contribution. But when you talk about technology, we have lots of ways right now of being able to use, for example, FaceTime or other systems where you can use your phone to be able to check on somebody. And that could be a way to have somebody talk to a doctor instead of making an office visit. And that can be a way to make sure that the individual takes their pills on time.
These seem like a series, 3 or 4 easy, nonpartisan, low-cost things. Where are we at the state level or in the legislature in getting some of these things done?
Let's remember that the Affordable Care Act was passed without one Republican vote. But that's not new in history. When Medicare was first adopted, in 1965, it was adopted with not one Republican vote. However, different from what's happening now was the fact that in 1965, once the first vote was passed and the Republicans said, you know, it's been done, it's over, they then worked cooperatively with Democrats ever since that time to improve Medicare and to improve Medicaid. It's happened for all of these years. So the fact that we have an opportunity now to improve the Affordable Care Act and that opportunity is not being seized is, I think, very sad.
Yeah.
And the medication issue is a primary one.
So on the right side of things, politically speaking, we have this contentious GOP debate. None of the candidates really are talking about these issues. What is your take on sort of the conservative perspective with respect to Medicaid, Medicare, the Affordable Care Act, wanting to repeal and sort of privatize and introduce it to a free market system, which will perhaps resolve the insolvency issue, they say?
The Affordable Care Act is all about the free market, because all of those insurance companies that provide the programs, they are providing their choice of program, but they have certain parameters they must meet in terms of certain required tests that they must do on people without charge, certain requirements that go into the amount of administrative costs that they can tack onto your policy. But the fact that we have all of these private insurers, all of these private HMOs, shows that it is a privatized program. What would be non-privatized is if we had Medicare for all. And even though Medicare, by the way, runs through a private sector provider scheme as well. But Medicare covers everybody, and everybody gets the same rights and the same program. We don't have that, obviously, with the Affordable Care Act. And the people who want to repeal and replace cannot replace it with anything that comes close to providing what we have.
Right. Since you've come out of retirement to run a phenomenal healthcare network here in South Florida, would you consider going back into the legislature to try and get some of these things done?
First of all, I've had my chance.
Okay.
And I had 18 wonderful years. I'm very grateful to the people of Miami-Dade County who sent me to the legislature and gave me the opportunity to work in the field of healthcare and in the field of education in so many areas that have made a big difference in the lives of many of our citizens.
And one last issue, and we'll let you go. In your op-ed, you had noted that perhaps one of the most important issues is the creation of support systems allowing seniors to stay in their homes. What do you mean by support systems, apart from the tax deductions that we alluded to, the use of technology and...
Well, all of these are support systems.
Okay.
And the fact is that we do have agencies in the community that provide services, starting with the Community Care for the Elderly Act, which I was privileged to write back in the late 1970s at the request of then Congressman Claude Pepper. It was his idea, but that's how we came to have the first program for people to stay in their homes and receive care without charge, even regardless of their income. So there's no feeling of taking anything from the community. Mm-hmm. And there are many programs that have been added to that. So we have the ability to help people stay in their homes. We're just going to have to do more of it. And we have some huge problems. The huge increase in people now who have Alzheimer's, for example. Aside from the fact that we must do medical research, we also must make sure that we have provision for people like that who cannot stay alone.
Right.
So,
I want to thank you for shedding light on a really important issue, particularly for South Floridians, but to help us sort of break through the GOP and the presidential noise, as it were, to watch out for these really important issues for senior citizens. So thank you, former Representative Elaine Bloom, for being here.